Before I ever wore a white coat, before I ever stepped into a hospital as a doctor, I was just a son. I remember being in my teens and hearing my father wake up in the middle of the night, sometimes 2 times, sometimes 5. I didn't think much of it back then, but I noticed how tired he looked in the mornings. He'd sit quietly at the table, sipping his coffee, eyes heavy. He never talked about it. Men from his generation didn't talk about things like that. Years later, during my medical training, it all started to click. He wasn't just waking up randomly. He was waking up because of his prostate, something that millions of men deal with silently. Now I work with senior men every day, and what I've seen over and over again is this. There's one very common habit that's slowly making their prostate larger, and most of them have no idea it's even a problem. It's a habit so simple, so ordinary, that people don't give it a second thought. That's why I'm making this video. If you're a senior or care about senior health, I need you to hear this. Let me explain why this matters. The prostate is a small gland. It's shaped a bit like a walnut and sits right below the bladder. It surrounds the urethra, which is the tube that carries urine out of the body. In younger men, the prostate is small and does not cause problems, but over time, it often begins to grow. Now, this growth is very common. In fact, almost every man will experience some degree of prostate enlargement as he gets older. This condition is called benign prostatic hyperplasia. That's just a medical term for a prostate that's getting bigger but is not cancer. But just because it's common does not mean it's harmless. As the prostate gets larger, it puts pressure on the urethra. That makes it harder for urine to flow. Men might find themselves needing to pee more often, especially at night. Some may feel like they can't completely empty their bladder. Others may have a slow or weak stream. This can lead to interrupted sleep, frustration, and sometimes even embarrassment. But it can also cause bigger problems, like bladder infections or even long-term damage to the bladder itself. I've seen seniors completely drained of energy, not because of age, but because they were waking up 5 times a night and never getting good rest. I've seen them stop going on road trips or outings because they're always worried about where the nearest bathroom is. Prostate health is not just about the gland. It's about how it affects your entire day-to-day life. If you are a senior and want to take care of your overall health, this is something you cannot ignore. If you are already getting value from this video, then I encourage you to hit that subscribe button and ring the notification bell to stay up to date with all future video. And also, don't forget like and share the video. Now, let's talk about the habit I keep mentioning. The one so many seniors do every day without thinking twice about it. Sitting too long. That's it. Sitting for long periods of time without breaks can slowly lead to problems with your prostate. And here's why. When you sit for a long time, whether you're reading, watching television, or working on a computer, blood flow in your pelvic area slows down. Your pelvis is the area between your hips, and your prostate sits right in the middle of it. When blood doesn't flow well in that area, things begin to build up. Pressure increases. That constant pressure around the prostate can cause swelling and inflammation. And over time, the gland starts to grow. This growth might not cause symptoms right away. You might feel fine for a while, but over months or years, the slow buildup adds up. And when symptoms do show up, it's usually because the gland has gotten large enough to press on the urethra. Now here's the thing. Most seniors are not running around all day. Many are retired. Some deal with joint pain or fatigue, so they rest more, which is understandable. But when you go from sitting at breakfast to sitting in front of the TV, then sitting for lunch, then sitting for a nap, and again sitting at dinner, your body never gets that chance to reset and restore blood flow. It's easy to fall into this pattern without realizing how much time you're spending off your feet. But your prostate notices. When seniors come into my office and tell me they're waking up all night or feeling pressure in their lower belly, the first thing I do is ask about their habits. How often are they moving around during the day? How long do they sit at one time? Most of the time, they're surprised. They don't realize how much of their day is spent sitting. But once they see it, they understand why I bring it up. Here's what I tell them, and what I'm telling you now. Set a timer, or use a watch. Every 30 to 45 minutes, stand up. Even if it's just to walk across the room or stretch your legs. You do not need to go jogging. You do not need to do jumping jacks. Just move. If you can, try to take a short walk every day. Even 15 minutes is a great start. If you feel good, work up to 30 minutes. It does not need to be all at once. You can break it into smaller walks throughout the day. This light movement helps in so many ways. It keeps blood flowing through the pelvis. It lowers pressure around the prostate. It also helps with weight control, heart health, digestion, and sleep. All of these are important for seniors trying to stay healthy. And let's not forget water. Drink small amounts throughout the day. But stop drinking fluids about 2 hours before bed. That can help reduce nighttime trips to the bathroom. Cut back on caffeine and alcohol too. They can irritate your bladder and make symptoms worse. A lot of seniors tell me they love their coffee or wine, and that's fine. Just don't overdo it. And if you are noticing signs like frequent urination, straining to pee, or waking up several times a night, do not wait. Talk to your doctor. There are safe and effective options that can help. I want to share something that I hear often. A man will come into my office, we'll talk about his symptoms, and then he'll say something like this. I figured I was just getting older. I thought this was normal. Let me tell you something. Just because something is common in seniors does not make it normal. Losing sleep every night is not normal. Feeling uncomfortable every day is not normal. Planning your day around where the bathrooms are is not normal. You deserve better than that. One of my patients, a 72-year-old man, had been struggling for over 10 years. He thought his symptoms were just part of being a senior. He had stopped going fishing with his friends. He had stopped traveling with his wife. He stayed close to home because of the fear of not making it to a restroom in time. But after just a few changes, standing more, walking daily, drinking smarter, his symptoms began to ease. He told me, I feel like I got my life back. That's the power of small steps. Your comfort matters. Your daily joy matters. Senior health is not just about avoiding illness. It's about staying sharp, active, and feeling good in your body. If you are a senior and you've been sitting too long every day, it's time to make a change. Your prostate is trying to tell you something. Don't ignore the time you spend sitting. Get up. Move your body. It doesn't have to be intense. It just has to be consistent. You do not need to accept discomfort as a normal part of getting older. You can feel better. You just have to take that first small step. If this video has helped you, please hit that like button and share it with someone who could use it too. And of course, subscribe to stay updated with our latest content. Thank you for watching, and see you in the next video.